let's talk about the prostate biopsy because that is a source of anxiety for a lot of patients. So talk to us about prostate biopsy. Talk to us about the experience. Talk about the types.
Generally, if we have an MRI that looks abnormal or your PSA is really high and we want to see if you have prostate cancer, we want to take little samples of tissue from the prostate. We can do that with essentially a needle that can take a tiny little core of tissue that's about 1.5 centimeters long of the prostate. The question is, how can we get to the prostate? Because if you were to go below the scrotum, it's like about inside about an inch or two. It's also just in front of the rectum. So there's kind of two ways of accessing it. One is that you can pass that needle through the wall of the rectum. So you put like a needle guide and poke through the wall of the rectum into the prostate. And the other one is that you can actually pass the needle through the skin directly into the prostate. And so these have different terms. So when they go through the rectum, it's called a transrectal biopsy. When it goes through the skin of the perineum or the space below the scrotum, it's called a transperineal biopsy. These biopsies are very different. There's like a big change in which one is becoming the gold standard now. And more people are moving away from the transrectal biopsy to the transperineal biopsies.